Hello there, and a warm welcome to this EMIC webinar. My name is Gregor Henderson, and it's my pleasure to be your host for today's webinar conversations. I'm a board member for the Mental Health International Collaborative, and I live and work in Italy, but most of my work is in the UK. Today, we're going to be talking about a very important set of topics. And the title is Innovative Approaches to Eating Disorders and Addiction Recovery, Insights from Body Peace Canada and ConnexOntario. Addictions and eating disorders are complex and are increasingly common. A 2024 study from the Butterfly Foundation in Australia found a 21% increase in eating disorders since 2012. In the UK, it is estimated that out of a population of 66 million people, there are 1.25 million people with eating disorders, with the largest number being under the age of 25. In the UK, 45% of adults have either experienced addiction themselves with a dependency to alcohol, drugs, medication, gambling, or sex, or they know someone close to them it has. And of those experiencing addiction, almost half said they found it difficult or were unable to talk about the issue. Long wait lists, restrictive criteria, or no care at all often present those impacted by eating disorders and addiction services from receiving support. Less than 30% of those with an eating disorder seek or receive treatment. Barriers include stigma, shame, a lack of hope, a lack of knowledge regarding available care. The evidence is clear. Early intervention and rapid access to care results in the best outcomes. But how to encourage people to reach out for support? Well, that's where our webinar comes in. With organizations like Body Peace Canada and ConnexOntario, they're creating welcoming virtual spaces to encourage people to connect with peers and professionals, decrease the stigma and shame, and increase hope for recovery. So let's get the webinar underway. This evening, we've got panelists from Nova Scotia and Ontario in Canada, and they're diligently working to make a tangible impact on access to support for eating disorders and addictions in their respective jurisdictions. You'll hear from each of them soon for 10 minutes, but first I've got a few quick points to mention. Please feel free to share your current location or area of interest. To do so, you can click on the three dots next to your name tag, choose edit, and add your country or area. This allows you to connect with others who share similar interests. If you have any questions for the panelists during the webinar, please feel free to post them in the chat box, and during the Q&A session, I'll do my best to include as many of them as possible in our discussion. Lastly, today's webinar is being recorded, and the EMIC team will soon share the recording in the Knowledge Bank. Now it gives me great pleasure to introduce our first speaker. And our speaker is Samantha Cornelson, a System Navigation and Information Specialist Team Lead at ConnexOntario, Canada. Samantha holds a Bachelor of Arts degree from the University of Toronto, with over 20 years of experience working in the mental health and addiction sector in both rural and urban settings. Samantha recognizes the importance of eliminating systemic barriers to accessing mental health and addiction care, and wholeheartedly supports educating individuals about mental health and addictions as a means to eliminate stigma. Samantha actively participates in her community as a board member for the local long-term care facility and frequently volunteers at special events. Samantha lives in a small, quaint, and rather beautiful Southern Ontario town with her husband and 2 children. Samantha, please join us in the webinar.
Hi, Gregor. Thank you so much for the introduction. I'm very excited to be here and share what we do here in Ontario at ConnexOntario. So I'm just going to quickly share my screen. Okay, so the purpose of ConnexOntario services is to ensure that all individuals living in Ontario, Canada, have toll-free access to information about funded mental health addictions and problem gambling supports and resources that are available within Ontario. We provide this service 24 hours a day, 7 days a week for all 365 days of the year. So our vision is to be able to provide a holistic picture of the mental health and addiction sector for adults, children, and youth, and offer assistance to all Ontarians by helping them navigate the very complex mental health and addiction sector here in Ontario. So what we do is we provide system navigation and information service for mental health, addictions, and problem gambling services. So working collaboratively with mental health and addiction organizations in Ontario, ConnexOntario is publicly funded to continuously collect, update, and store information for over 6,000 mental health and addiction programs and services. And we use this information to provide confidential system navigation and guidance to individuals living with mental health and/or addiction concerns, including feeding and eating disorders. Currently, there are only 74 specialized programs for eating and feeding disorders in our database, which is not as many as 6,000, as I mentioned earlier. So very few resources out there. Our team reviews the information that's on our database yearly, and we ask organizations to report any changes to us throughout the year. And we also ask organizations to provide updated wait times frequently to us so that when callers are calling in, we can provide them with that information. The other thing that we can do is we can report on over 600 data points with the information that we have. And we use this to refer the individuals to appropriate services, as well as for the system planning. So using this non-identifying information from callers who disclose having eating and feeding disorders, we can provide this information to system planners to help identify and address any service gaps. I just want to clarify too, it is all non-identifying. We do not collect any identifying contact from the people calling us unless it's, imminent risk and we need to access emergency services for that individual. So our system navigation team assists individuals in accessing and maneuvering through the complex mental health and addiction system. It involves guiding individuals to the appropriate programs, services, or resources that meet their needs and preferences, as well as helping them understand and navigate the various steps and processes involved. As we know, it's never easy sometimes just to, walk in and get services for something as complex as feeding and eating disorders. Our team will provide information, supportive listening, education, and assistance in overcoming barriers to accessing these services. And we are a live answer information center that's available 24/7. So we always answer our callers. So our system navigation specialists will work with individuals to discover their preferences and needs. We conduct a search of the system to best match the individual's needs for where they are today. So asking them what they're looking for, what are their needs, how are they feeling, and their presenting issues. We can also filter multiple criteria in our database by ethnocultural group, age, gender, presenting diagnosis, any legal issues, etc. And then we can explain and provide information on the next steps for the contact that they need to do to access these programs. And then we can email this information to them so they have it for when they're ready. If it's today, if they're ready next week, they'll have that information and they can go forth with what they have. A key component of our services is listening to an individual's needs and concerns and letting them know that they are not alone, that other individuals may have had similar experiences, and that recovery is possible. By doing so, we hope to help diminish the stigma and shame associated with mental illness and provide the hope for recovery. So what we offer is general information, service information, and supportive listening. We look for programs and services where the individual is currently living, so in their local area. We can provide them with the estimated wait times to the individuals, And we also offer free translation services, either over the phone or through web chat. So individuals can connect with us by calling our 1-800, our toll-free number here in Ontario, by texting us through web chat, and of course by email. So I just wanted to mention that anyone can call us. We are open, the general public can call us, people looking for support for themselves, loved ones looking for support for family members and friends. We have healthcare professionals calling us. and people from the legal sector and researchers. So in this past April, you will see that we've had family members call, friends and citizens and professionals. So I pulled stats just for the feeding and disorders contactor type, and you'll see that the majority of people calling regarding this concern are the people themselves, but then we also do have the family and friends making up a piece of that as well. The thing about family and friends, too, is that we can also provide information for them as the loved one supporting somebody with a feeding and eating disorder. So often as they're the main caregivers, we can provide them with family support programs as well. So what information do we give? So we do give the program description. So this will provide a detailed information about what the program or service is all about, how to contact that service, any referral information, so how to access that program. Are there forms to fill out? Can you call them? Do you email them? Is it through an online portal? So we can provide that to the people calling us. We can also talk about program restrictions. So what are the eligibility criteria? Do you need a formal diagnosis? Can you be self-diagnosed? Do you require a physician's referral? Are there medications or legal issues that might be a restriction to that program? We also can provide program hours of operation, so you know when to call. We can also provide the average program length and the estimated wait times that the organizations are reporting to us. So the information we provide is thorough and helpful and provides guidance to individuals who are reaching out for the first time. We let individuals know that services are available to them, what they need to access these services, and what they can expect when they reach out. Sometimes, as we know, the hardest thing for an individual to do is to ask for help, and we try to make that as easy as possible for people seeking help. Oops, sorry, I scooped ahead here. Okay, so here we are. So feeding and eating disorders. So during April, we had 4,142 contacts. And of those 4,142, 290 of those individuals identified a feeding or eating disorder, which makes up for about approximately 7% of the people calling us. So from that, we were able to provide information and services for 1,180 programs to these individuals. You'll also see that we can divide it into what the diagnostic criteria is. So 128 of them identify as having anorexia nervosa, 70 of them identify as having binge eating disorder, 40 bulimia nervosa, 23 avoiding restrictive food intake disorder, and 2 identified as having pica. So the common referrals for feeding and eating disorders here are inpatient programs, intensive day treatment programs, outpatient programs, and community counseling. But as I mentioned, our role is to provide information and to refer individuals to publicly funded services. We don't conduct any formal assessments for feeding and eating disorders, but what we do is we ask those clarifying questions to help identify what the individual's needs are, what their preferences are, and where they are today, so we can best match them with the services they need today. And we're recognizing that we may be an individual's first call or only call for support due to struggles of shame and stigma. Our goal is to reduce as many barriers as possible. One of the biggest barriers individuals face is the current wait times for specialized feeding and eating disorder programs. Wait times for programs in Ontario can range from 3 months to 2 years plus, depending on the location and the type of the service. And some of the other challenges with accessing these programs can be that, having certain eligibility criteria, having a specific body mass index, making sure that your mental health is stabilized, no substance use, as well as even needing referral from a physician can be a challenge, as we are experiencing a shortage of physicians here. Not everyone has a family doctor, so that can be a big challenge. So just thinking about that eligibility criteria, you can see that some callers identify as having a feeding eating disorder, also identify as having other mental health and or addiction concerns, which also may require support. So these coexisting issues can create additional barriers to these individuals accessing services, as many of the programs do require stabilized mental health and or no substance use. So if an individual identifies a coexisting issue, whether it's formally diagnosed or not, we can offer services and programs that address these issues. And we hope that the individual can access these other resources while they're waiting for services, if they're waiting for services for the more specialized eating and feeding disorder programs. So by doing this, we are hoping to eliminate some of the barriers associated with accessing these programs. So as system navigators, we always want to provide hope to individuals by letting them know that there is help out there and recovery is possible. And we address these challenges by attempting to offer the best possible support information to individuals. Providing information for less intensive and easy to access virtual services or for services that have no or very little wait times is crucial. And so such programs include peer support programs such as Body Peace Canada, specialized helplines and resources such as the services offered by the National Eating Disorder Information Centre here in Canada, as well as online education and self-help through mindyourmind.ca, which actually is also a department of ConnexOntario, where we are trying to engage youth and do some prevention for mental health, including feeding and eating disorders. We also will offer services on community counseling programs, sometimes just to start with some therapy for, your cognitive behavior therapy or something, so you can start working on that part of the journey. So eating and feeding disorders affect people of all genders, sexual orientation, ages, socioeconomic class, abilities and races, and ethnic backgrounds, as we all know. And at ConnexOntario, we work every day to help make accessing these services a little bit easier by providing supportive listening, by asking the individual what their needs are, and by providing current and up-to-date information regarding services available to those individuals. And we definitely provide a welcoming environment for people to talk about their struggles and open up to, so we can help them in a very confidential and non-threatening way. So I just want to say thank you for your time, and that's all I have for you today. Thank you. All I have.
Samantha, thank you very much. That was great, really comprehensive, a fantastic overview of your service. Thank you very much. I'd like to introduce our second speaker, who is Shalene Jones, who's the Executive Director of Eating Disorders Nova Scotia and Body Peace Canada. Shalene Jones has been an advocate, organizer, supporter, and all-round rabble-rouser, her words and mine, in the field of eating disorders for over 25 years, holding leadership positions with community organizations such as BC Eating Disorders Association, Langhouse, Peer Support Canada, and CMHA National. She's the Executive Director of Eating Disorders Nova Scotia and the founder of Body Peace Canada. Having overcome an eating disorder herself, she is passionate about recovery, the transformative power of peer support, and creating sustainable, systematic change across the sector. Shalene was one of the first people trained to provide peer support for those with eating disorders in Canada, and earned her peer support certification from Peer Support Canada in 2015. Now, just let me add a little bit more to this. Shalene, you've been recognized for your work with an Inspiring Lives Award from the Mental Health Foundation of Nova Scotia, the Invisible Champion Award from the Biana Family Foundation, and the Association of Psychologists of NS Community Award in Mental Health. You serve on the Mental Health Advisory Council to the Federal Minister of Health, and you're a member of the Mental Health Commission of Canada's Hallway Group, Quality Mental Health Care Network, and the E-Mental Health Collaborative. That is one impressive CV and set of awards. So we're looking forward to hearing from you, Shalene, who will speak.
Awesome. Thank you so much for such a lovely introduction. It is such a pleasure to join you all today and to get to share with you the work we're doing through Body Peace Canada. I'm going to try sharing my screen, and I've been having some technical difficulties today, so let's see how this works. So one moment, please. I think it worked. Okay, fantastic. All right, excellent. So my name is Shalene Jones, and I'm with an organization called Eating Disorders Nova Scotia. And we had a sticky little challenge to try to figure out. So as we kind of have been speaking about so far this afternoon or this morning, depending on where you're zooming from, eating disorders are incredibly common costly, complicated mental illness. They impact around 7.8% of the population over their lifetime. And what we're hearing from reports from our colleagues in Australia is that we're continuing to see increasing numbers of people who are impacted by these illnesses. And eating disorders carry one of the highest mortality rates of all the mental illnesses and can create so much pain and suffering for those who are impacted by them. So we know that when people are able to access support, they're able to fully recover from these illnesses. And we really believe that everyone deserves access to the supports that they need for recovery. So our challenge here is that with these common, complicated illnesses, many people are not seeking or receiving treatment. And so that diminishes their opportunity for recovery. People often struggle with eating disorders for a very long time before they seek care. The average is about 7 years. So we're really looking at how do we shorten that gap between onset of symptoms and when people are able to receive care, because the research is so clear that the sooner someone is able to access support, treatment, resources, etc., the shorter the duration of the illness will be. The research is showing that the longer the illness is in place, the more entrenched it becomes and the harder it is to recover and the more costly it is, both emotionally and financially, for the person to recover. So one of the challenges is the immense personal shame and secrecy and stigma that people who live with an eating disorder are facing, as well as not being aware of what resources might be available. So really feeling stuck in that sense of I'm alone with this. I don't know if I deserve care. I don't know where to go for help. I should be able to deal with this illness on my own. So folks really not having that information on where to even start and if their concerns would even be taken seriously. So Samantha, I loved what you spoke about just a moment ago about that supportive listening and creating that welcoming space where people can really connect with someone else and feel safe and secure in sharing what their concerns are and getting help navigating. So our challenge with Body Peace Canada was how do we encourage people to reach out for support? And we talked to so many people. We held wide consultations. We spoke to folks who are accessing treatment and support, our team of 55 plus trained mentors. We went out to the literature, reviewed existing work. And what we really heard was the importance of creating services and supports that had that vibe, that welcoming, authentic, easy to access vibe, and that space that was really supportive for folks. So we wanted to create an online service for folks who are struggling with an eating disorder, where they would see themselves reflected in the services and the resources that were available, where the online space would be one that was very welcoming and encouraging and validating for their experience. We wanted to create a space that was safe. We wanted to ensure that the folks who were providing the peer support through Body Peace Canada were very well trained and very well supported. And we were making sure they were delivering that peer support in a way that was really consistent with the model that we had created. And of course, we wanted it to be free. So here in Canada, we have a number of provinces and territories throughout our country, and delivery of healthcare is left up to each of the individual provinces and territories. So we have, in effect, a bit of a patchwork quilt in terms of what services are available and who can access what. Professional services are regulated by each province. So there was a bit of a gap for folks, not only in parts of the country that didn't have any specialized eating disorders treatment, which was an alarmingly high number, but there weren't a lot of supports that were really leveraging the power of peer support to create this welcoming, authentic, safe virtual space where people from coast to coast to coast could access the same services and the same level of support. I love peer support so much. I believe it's one of the most powerful tools that we have. As Gregor mentioned in my introduction, I was trained as a peer supporter, so I'm a bit biased. But I lived with an eating disorder, and part of my recovery process involved connecting with others who had also been through that recovery experience, and being able to be part of a safe community, a community that understood my challenges, where I could give and receive support, was incredibly transformative for me. And having worked in the space now for almost 30 years, being able to witness other people's journeys as they've been able to connect with a peer supporter has been an incredible gift. From the research and the evidence, we're seeing that peer support really aids in decreasing isolation, increasing the social support networks, building hope for recovery, increasing motivation, and increasing people's ability to be compassionate towards themselves. So we found that peer support was a fantastic tool to use for folks who are not sure if they're ready to fully engage in recovery, who are kind of in that recovery curious phase. For folks who had already accessed treatment and were looking for additional support to maintain those gains. And for folks who are really experiencing mild to moderate eating disorders as well. So it really fits into a lot of places along someone's recovery journey. So just over a year ago, we launched the Body Peace Canada. And this was built on the 20 plus years of experience that we had as Eating Disorders Nova Scotia, delivering our peer support programs. We wanted to make those programs available for everyone across Canada. And of course, with the name that is province specific, we had to come up with a new name. So we created Body Peace Canada. And that was how people were able to access peer support and additional resources across the entire country. So Body Peace Canada is our free online resource. It's available to anyone in Canada who is 14 plus. And we really promote this as a resource for folks who may be living with an eating disorder, as well as folks who may identify as having concerns with their relationship with food, eating, body, exercise. And we really intentionally use that language in recognition of the internalized stigma and shame and perceived barriers that folks were experiencing or felt as they're trying to navigate eating disorders care. So we don't want folks to have to, right off the gate, say, yes, this is an eating disorder, I have an eating disorder, I need help. We just wanted them to be curious about what supports may be available. Samantha had also spoken about some of the challenges with receiving care in Canada. I think you mentioned it, up to a 2+ year wait list, which is just heartbreaking. And then other requirements in the way that our provincially funded healthcare system is set up. There is a bit of a not quite as many resources as we would like to see for eating disorders, probably the same for everyone here today. And so often really strict criteria for being able to access that support, and often really hard choices being made so that only the folks who are the most severe, the most critically ill, are able to access intensive treatment and services. So we tried to create a virtual support that tried to eliminate as many of those barriers. So we didn't need a referral, we don't need a diagnosis, there's no wait list for anything, it's immediate access. And our peer supporters are here to support folks every step of the way. So what are some of the resources that are available at Body Peace Canada? Glad you asked. We really focus on the peer support component. So we have a huge variety of peer support groups that folks can access, which are, they can be drop-in, they can be closed groups. We have for a variety of different demographics and target groups, really trying to create that designated space for folks. We also offer individual peer support where folks are matched with a peer mentor. In addition, there's some resources that are designed to support learning, including some videos and worksheets and other self-paced learning materials. So folks can just go through those, looking at what's important to them and go from there. And we also have a self-assessment that the Inside Out Institute in Australia has kindly allowed us to use. And this is a short 6-question assessment that determines risk for having an eating disorder. And we use this as a way of really encouraging people to explore that curiosity and to receive some validation for what their concerns might be. So after they complete the survey, they get a customized score and steps for them to do their next steps, if you will. And that will often include connecting with their family doctor. There's a guide they can download. They can print off their assessment, and then we can connect them back to other resources like ConnexOntario and NEDIC, or the National Eating Disorders Information Center. So really encouraging that help-seeking behavior and providing people with a specific next step they can do, and at the same time connecting them with peer supporters who can continuously guide them through that process. Okay. So the outcomes, the impact, it's always so helpful to do a thorough evaluation and see what's working, what's not. We worked with a researcher from the Children's Hospital of Eastern Ontario here in Canada to evaluate the outcomes of our peer support program. And overwhelmingly, we found that participants felt a connection to others, a sense of belonging, that increased self-compassion, that motivation, readiness for change, and just feeling they're better able to cope and more hopeful for recovery. So we feel that the evidence was clear with our evaluation that the peer support helped people get ready to make those next steps, prepared them to really fully engage in their next steps, which would likely be more intensive treatment, or continuing to work with their peer mentor or with the self-directed resources and working in the community with private therapists or other resource programs. So really providing that safe space to move forward. We really wanted to provide a support where people didn't have to wait, because you know how demoralizing it is to summon the courage to talk to your family doctor, and then to be told that yes, you may be sick enough, you may be very ill, but it's going to be 2 years before you can do anything, so go home and wait. And so our self-assessment, the results are immediate. All of the self-directed resources are available right away. We have 7 peer support groups running every week, so chances are good that you can access one in the next 24 to 48 hours. And then we have live workshops and information sessions every week. And then usually within a couple of weeks, folks who have requested a mentor are matched with one for that one-on-one peer support. And we're finding that only a small portion of folks need medical care, so we're really hitting that target of folks who are early in their eating disorders trajectory, early in that pathway, and don't yet need medical care, which is great. And our belief is that this will keep them moving forward in recovery and they will not need that clinical care. Okay, so our training for peer supporters is very robust. Every trained peer mentor works with us for 5 weeks, really focusing on skills, knowledge, a ton of self-reflection, and then some real skills around self-care, boundaries, learning more about recovery, weight bias, and focusing on how to share your story safely and with intention, how to do that in a very mindful way. Our peer supporters also have ongoing support from our staff team, who do a variety of individual coaching, monthly meetups, quarterly community practice sessions. All the mentors complete a self-reflection after every interaction. And so we're able to review those, look for trends. There we go. And ensure that the peer supporters are working within scope of practice and we're able to flag any issues before they come up. So we really want to make sure that our mentors are providing peer support in a way that's safe for them and is safe for others. And I just want to leave you with a couple of quotes from folks who have used Body Peace Canada, who can speak to the hopefulness they felt being able to be connected to others and being able to work with a supportive pro-recovery community. The slides will be, I think, available afterwards, so make sure folks have access to those should they want them. And you can, of course, contact me if you have any questions. And if you wanted to scan that little picture, with your phone, that will take you to a sign-up form for our Body Peace Canada newsletter. So you'll be able to receive updates that go out once a month about program information. All right, so thank you all so much. It's been a pleasure to chat about body and the impact we're having.
Shalene, that was great. Thank you very much. That was fantastic. Thank you. Samantha, would you like to come in and join us now? That would be great. Okay, everyone, I put something in the chat saying, please have your questions ready for Samantha and Shalene, as we are now, I'm going to ask a couple of questions first, and then we're going to go into the audience for Q&A. We've already got one question up from Sophia. So thank you very much for that question. So please keep them coming. I guess one of the things that is absolutely glaringly obvious to me, that it's so critical to have supports that are easy to access. And I'm just pondering here, as I do, not just for your jurisdiction, but for mine and others, why it is that when there are waiting lists for standard services, those standard services aren't referring to organizations like both of yours on a regular basis? So the moment the concept of you meet the criteria, you need some support, or I hear you, and there may be a wait, but during that wait, you can access these services. How do you relate to local, regional, and other services to get them to understand that you're there, you're available, you're safe, secure, you've got safeguarding procedures? How do you relate to your local and jurisdiction-wide services to make sure we can open this up at scale? Samantha, do you want to go first, and then Shalene?
Yeah. So we do a lot of that system navigation. So people might not be referred to us necessarily to engage in a program, but they definitely call us so we can look for more supports for them while they're waiting for services. I think that we do have partnerships with a lot of our organizations here in Ontario, given the nature of our business. So I know they would refer individuals to contact us. But we don't always have the right answer, because then again, we're looking at more wait lists. So we have to get pretty creative and start looking for things like, Peace Body, Body Peace Canada, or, NETIC, which is the national eating source. We get creative and start thinking about where can we find, and a lot of times it is like peer support, maybe informal peer support programs, where people can find that support. So I don't know, Shailene, if there's something you want to add there.
No, the crucial point is all part of that user experience, the person's recovery journey, and where they start when they start experiencing symptoms, and what pieces of the system they bump into along the way, and ensuring that, their family doctors or healthcare providers are aware of resources, and that the formal mental health care system that focuses on eating disorders is aware too. So that's a definite part of the work that we do, is connecting with the different individual treatment programs in Canada to ensure that they're aware of what the programs are. We've worked really closely with our eating disorders treatment programs here in Nova Scotia, which is, again, a population of about 1 million people. So really partnering closely with local resources. I think one of the challenges we have with Canada is that patchwork quilt process, where there are so many different jurisdictions, and not often like just one organization that you can contact.
Yeah. And do either of you use like media, TV or radio? How do you get your message out there? There are ways to get across, and obviously with social media and the way in which you can access that, do you have big social media presences? So again, just a little bit of discussion there about what some of the ways are that you can actually get as many people as possible having immediate access to that kind of support.
Yeah, it's not enough to build it and just wait for folks to come to it, is it? Yeah, so definitely all those things you said, so everything from, individual calls with clinicians, to social media ads and targeted ads on Facebook, to webinars, like every opportunity we have to connect with referring partners and to folks who may be impacted it's a core piece of the work that needs to happen.
Yeah. Okay, great. Samantha?
Oh, I was just saying we're all definitely on the social media platforms, and we'll often run campaigns too. So even right now we have a partnership with the Go Transit system here in, Toronto mainly. So you will see like a billboard with our information there, that if you're having issues with mental health or addiction, so problem gambling, you can call us. We'll help navigate and support you along the way. So we often do campaigns to support or to information about our services. Yeah.
Great, good. Okay, I'm going to go to some questions from our audience. So this is from Sophia. Any eligibility criteria to become a peer supporter mentor? Shalene, I think that's aimed at you.
Yeah, excellent question. The minimum requirement is that they have 2 years of experience in recovery. So we want to be able to work with folks who are able to draw upon their experiences with that recovery process, not just with having an eating disorder. So folks who have excellent self-care, who've done so much of that emotional labor to get to a good place in their recovery, so that they're able to support other people in a way that's going to be safe for both of them. And then beyond that, folks who live in Canada and are able to, to work with a certain number of hours per week. We have staff who are on our team who are peer supporters. And then we have folks who are doing anywhere from 2 to 10 hours per week of peer support work. So they have to complete the training, they have to have experience with recovery, and then all those great personality skills, like good communication skills, excellent self-awareness, all those other skills you would think of.
Right. And another one for you, Shalene, are the mentors paid or volunteers?
We use a paid model. So mentors receive a payment for their peer support interaction. So if they're facilitating a group or they're doing one-on-one, it's like a fee for service.
Okay, great. So here, this one is from Shanda Silva. Can I please ask if your organizations have developed and or identified resources specific to younger people, 14 to 25? So Samantha, yes. Can you pick that up and then Shalene come in?
Sure. Yeah. So we do identify those programs. So when we are speaking with the organizations in Ontario, we ask what the age range is. So when people are calling us and looking for services, we ask their age, and we can easily find those programs and services based on their age. The other thing we do have is mindyourmind.ca, which is our Mind Your Mind. It's a department of Connex. And what they do is they do a lot of youth engagement, and then they co-create. So what they do is they meet with youth, and then they co-create resources and tools for youth. Some are geared towards eating and feeding disorders, and some are towards more anxiety or depression, or just kind of self-care or getting to know yourself. So if you go on the website, mindyourmind.ca, it's a great place to start just for some interactive tools, a very non-intensive, very great place just to get started and learn about yourself and decide if you need to move forward with more options, or if that's just enough of service for you, so to speak. Yeah. So I hope that answered that question. I'll go ahead.
Yeah, great.
Yeah, so it is such an important demographic. So we have we run groups for folks who are 14 to 17. We have an ongoing drop-in group for young adults, especially folks who are in that like early university transition age folks. And then our peer support programs where we match folks up one-on-one. Those are available for 14 plus. We also work with our local health authority on a transition program. So we work with folks, young people who are transitioning from pediatric to adult care, and we match them with a peer mentor to kind of help them bridge that gap between services.
Right. On the age registration issue, a lot of people in the digital world are concerned about age verification for registration. How do you get around that in terms of your service, Shalene?
Yeah. So for our individual mentoring program, the process involves meeting with one of our staff members one-on-one, and that's usually done, through Zoom. So we're able to get a sense of them as a person, and helps us match them better, and it helps us create that welcome space for that person where they know people right off the bat. And that gives us opportunity to ensure that they do meet their requirements.
Right. Samantha, anything around age restriction issues for you, or is that something that isn't a concern to the service?
It's not really a concern, because we'll support anybody that's calling in.
Yeah, exactly. I mean, if a young person reaches out and they're 13 or they're 12, our role is to kind of help them find the best resource. If that's not us, then we'll help them find something else.
Yeah, in the UK, we have some of these issues where online services are providing supports and information, and they've got to make sure that those supports and information are absolutely age appropriate. And if they're deemed not age appropriate, then there can be some backlash, understandably so. So, question for you, Shalene: do your peer workers do any work in partnership with clinical services once people have engaged with them? And if so, can you describe that? That's a question from John.
I love these questions. They could. And often people will have a team they'll be working with. So with Eating Disorders Nova Scotia, kind of like the parent of Body Peace Canada, we have clinicians on our staff team. So certainly folks who live in our area are able to build their support team that will include a dietitian, a therapist, and a peer supporter, and then they can give consent for information sharing if that's something they would find helpful. And, you know, we really want this to be driven by the person. And we really focus on being very much person-centered and recovery-oriented. So if someone is working with one of our peer supporters and they want to loop in their clinician, or if there's other ways that we can be of use, then, you know, we will figure that out with them.
Okay, good. I'm asking for more questions, but in the meantime, let me ask one. What if, Samantha, on a kind of day-to-day, week-by-week basis, what are, you know, some of the highest level challenges that you face as an organization in providing your service? Can you share with us some of the challenges that you have and how you go about mitigating some of those?
Oh gosh, I don't know if I was ready for that question, but so our services, like we don't only focus on the feeding and eating disorders, that we are very generalized in terms of all mental health diagnoses, addictions, and problem gambling. So I think one of the things that we struggle with is, you know, often we will get calls from people who are in distress and crisis, and they need service today. And those wait times can be such a challenge to support individuals, and any specific eligibility criteria, right? So, you know, for example, you need to have this assessment done in order to go to this program, but you can't get that assessment done for like 3 weeks because there's a wait time, and then you have to go to this program, and hopefully you can get in. And you know, or just things like, you know, you have to have this diagnosis or you can't be on. So it's about, those are our challenges, Gregor. Those challenges are about trying to find the shoe that's going to fit the foot perfectly, which can be a challenge. So I don't know if I answered your question, but
no, you haven't. I think that just, you know, the symbiotic nature of the navigation and the peer support is very impressive to me. And that whole notion of, look, you know, we're trying to match you, we're trying to fit you, we're trying to find the right fit for you, but there may be a slight wait. Let's keep working on that. In the meantime, should you require an immediate access service, et cetera, then consider contacting these, because that must be quite distressing for some of the navigators as well. But it's just that whole always finding something that can hold or hear or support. Shalene, how about you? Some of the challenges and some of the thoughts in response to that question.
Oh, I think we only have a few minutes left. We have so many amazing clinicians and folks who are able to draw upon their lived experience. So I'm so grateful for the folks who are working with us and working with other groups across the country. Your work, Samantha, you know, all these kind of like the caring adults out there who are supporting folks who are going through this process. We have some structural challenges in Canada with the way healthcare is delivered provincially. If I had a magic wand, like being able to simplify some of those processes, increasing access to treatment, more training for healthcare providers, training for family doctors, standardized assessments at the pediatrician's office, like a couple things would be lovely to see.
Right. Question for Samantha from Sean De Silva. Building on a previous question, are you aware of any eating disorder services in Canada focused on young people that use a combination of online resources along with healthcare professionals?
I would say no off the top of my head, but I think the place where I would go would probably National Eating Disorder Information Center.
I would say Healthy Mental Health in Vancouver.
Yeah, and this is what Shailene's talking about. We're very provincial, right? So all of my programs and services and knowledge is really Ontario. And so then, you know, British Columbia could have a fabulous program, but again, it's probably for residents of British Columbia, maybe national if you're like Shailene and have a virtual service. So, So
I mean, that's another challenge too, the number of like pediatric programs in Canada. Like, there's so few of them.
Yeah, I mean, it is interesting. I mean, I think part of that is around digital literacy and literacy of healthcare professionals and that ability to mix and match different modes of service delivery. I think we are beginning to see amongst a new range of clinicians or clinicians who are beginning to look at some of these issues with a broader lens, that they are very happy to combine online services, particularly peer support, where they understand and know that there are safeties in place, et cetera, with face-to-face healthcare professional. And we are seeing more of that. And there is definitely a bit of a move to try and get professionals much more literate about those connecting and integrating services, which I think is great. That'd be really, really impressive. Okay.
I'm just going to add to that, Greg. Oh, sorry.
Yeah, go on.
I was going to add to that, Greg. I was just thinking, because even when I think about Ontario and how geographically different we are, we have Northern Ontario where services are sparse, geographically separated by hundreds of kilometers. And so accessing services is such a hard thing for people to do. And so I agree with you that doing that digital virtual services is definitely helpful in situations like that, where it's just impossible to get to services sometimes. Yeah.
And we are seeing the generation, whether they're Z or millennial, whatever moniker people have, just so ready and aware to use a combination of things. And I think sometimes people of my generation don't really understand how much of the web and weave of everyday life that is. You're online, you're offline, you're talking, you're communicating face to face, you're back online. And for people living, as you say, in more remote communities or in situations where they find themselves to be more remote and less connected, the digital world is an absolute savior when provided appropriately. Shalene, anything?
Yeah.
Okay.
So yeah, I always have like a few extra last words, but there's an eating disorders clinician in Ontario. And he had a quote, which was that if eating disorders was an illness that impacted middle-aged men like prostate cancer, we would have eating disorders treatment centers on every street corner. And I would think about how common these illnesses are, how they impact folks who are experiencing food insecurity, folks who have experienced trauma, folks who are trans and non-binary, folks from all genders, body sizes, weight, et cetera, and the resources are woefully inadequate to treat them. And we have been struggling as a caring community to try to build up a support network when we have been so chronically underfunded in Canada around eating disorders treatment and prevention.
Yeah.
There's my soapbox for the night.
No, great. Well said. Samantha, and I'm going to ask you both after some of the concluding remarks, Samantha, just to give us something positive at the end. So Shalene, I'll come back to you, but Samantha, just any last thoughts? And Samantha, what are you seeing as green shoots of optimism?
I think the peer support program that Shailene is doing is absolutely a green shoot. I'm so excited about that program. And I wholeheartedly agree in peer support. I worked direct service for a long time, and I know that people need to know they're not alone. Someone else has done this. Recovery is possible because I've seen it happen with this person. So you can do it. Those are my green shoots. That's my cheerleading way to end, I guess. I don't know.
Great. I love it. And here we are at the 11th hour. We've got an AI question. So let's just dive straight in 1 minute. Thank you, Lynn. You saved the AI to the end. Any thoughts or uses today of AI in assisting folks to connecting with most appropriate information and services? A quick last thought on AI. Shalene first, then Samantha.
Proceed with caution.
Samantha.
I'm going to agree. I agree. We do chats, we do SMS messaging here, and people will ask us if we are robots. They don't want to talk to AI. They want to talk to a person. They want to know that someone's listening, someone's hearing them, someone's validating them, and someone cares. Someone cares enough to help them. That's what they want. AI, make streamline things and make it easier, but that's what my experience is with some people.
Okay, great. Thank you. Lovely words. Okay, thank you both, Samantha and Shalene, from myself, EMIC team, and all our audience. I'd like to say a huge thank you to you both for contributing so much value to today's discussions. That's it for today, folks. It's been a great pleasure having you with us. We can't wait to see you at our future webinars. So please tune in. And thank you very much for all your questions. And whatever time of day or night it is, go safely, go well, and be happy. Bye for now.